Hi, I'm Kathy, Centre Head at Maggie's Wirral. At Maggie's we support people with cancer and their friends and family through the many challenges of a cancer diagnosis. Our busy centre is a warm, welcoming space for you to get answers to the questions you may have about cancer and to deal with the impact it's having on your life. The idea of this session is to explore and learn more about what to expect from immunotherapy. We'll go through what treatment looks like, outline the side effects you might experience, and share where you can get support from. You'll hear from nurses and doctors from the NHS, experts like the staff here in Maggie's, and people who've been where you are now.
As a consultant, I've seen firsthand the benefits this Getting Started session has for my own patients. After attending this session, they come to treatment better prepared, with a greater understanding of what to expect and feeling much more supported throughout. I also know that the information shared here helps friends, family members and carers too.
I came in here straight away with my mum and brother, and we were just blown away by everybody here. The welcome from the staff and the volunteers, the architecture, the view, and it's just a beautiful, tranquil Zen place, which has been a godsend basically to myself and to my family members who sit here patiently waiting for me whilst I'm over having my immunotherapy each month.
I was just a mess, and so I was really lucky in the fact that I came into Maggie's and managed to speak to some of the staff here, and I left feeling just a whole lot lighter and a whole lot more positive.
I still come to Maggie's, and I would say it's been the biggest single thing which has helped me realise there is a lot more happiness to come in my life, where at one point I thought there wasn't.
I would try and encourage anyone to come in earlier rather than later, because it's so nice just to have somewhere to go that feels kind of like a home away from home. We've all become quite close and quite good friends.
It changes your whole perspective, seeing it working, you know, having the regular consultations and being part of this centre as well just helps you to be able to find those bits of hope and to know that there is life outside of the cancer diagnosis.
Immunotherapy works by helping the body's immune system to recognise and destroy cancer cells. It is given in blocks called cycles and can be given for up to 2 years. Immunotherapy is given as a drip or infusion into the vein in your hand or forearm. This is delivered through a needle that is inserted by a nurse and removed when the treatment is finished. Immunotherapy can also be given either via a PICC line or a portacath.
Before your first appointment, a member of the ward will contact you by phone, or you will get a letter with a treatment time. Your treatment is a priority, so please take the first appointment offered. Your treatment will take place on floor 6 at the Clatterbridge Cancer Centre, Liverpool. Prior to every treatment, you will be asked to have a blood test. This will usually take place at the Clatterbridge Cancer Centre, Liverpool, or at Paddington. They will also give you your future appointment times, as well as the 24-hour contact numbers you may need. When it comes to getting to and from treatment, we recommend, if possible, that someone else drives you. On non-treatment days, you can drive as normal as long as you feel well enough. Children should also not be brought into the treatment area for their own safety. On the day of your treatment, here's what's helpful for you to do in advance. Have a healthy meal, whether breakfast or lunch. Drink plenty of water and make sure your hands and arms are warm. This will make your veins more easily accessible. Wear comfortable, loose clothing. Bring something to read, watch or listen to when you're on the ward to help pass the time. At every appointment, the nurses will check how you are in case anything has changed. The length of your appointment time will depend on the type of treatment you are receiving. Before you start, there will be time to discuss your treatment with your nurse and oncologist. They will answer any questions you may have and check that you are happy to proceed. They will ask about your current medication, so please bring the tablets you currently take with you. If you're having therapy into the veins, we will have a look at the veins in your hands and forearms and discuss any concerns you may have. If you're receiving your treatment through a needle in your vein, problems can occasionally occur. Therapy can leak into the skin around the injection site, where it can cause the surrounding tissue to become sore and inflamed.
Damage to your hand or arm is a rare occurrence, and our nurses are fully trained to try and prevent this. However, there are several things you can do to help us reduce this risk. Position anything you might need during your therapy, like drinks or a book, next to your free hand before your treatment starts. Keep the skin around the drip visible at all times. It is helpful to wear short sleeves or ones that can be rolled up easily. Stay patient. Sometimes it can take more than one attempt to place a drip. If your nurse is concerned about a drip, they will start again in another area. Although this can be frustrating, it is done for your own safety. We ask that you do not leave the ward whilst you're receiving your treatment for your own safety. We also understand your specific treatment may not always be what you need advice about. You will have a cancer nurse specialist who is part of your specific cancer team. Because immunotherapy activates your immune system, it can also cause inflammation, which leads to the side effects you may experience.
In the days after your treatment, you may start to notice physical side effects and emotional challenges too. The team are always nearby and on hand to help you with any worries you may have.
In the days after your treatment, you might start to notice physical side effects and emotional challenges too. In this section, we'd like to talk you through what those might be. These do not apply to everyone, and many receive treatment without noticing them. However, it is still really important to be aware of them and how to manage symptoms if they occur. Some drugs specific to certain treatment regimens can also cause side effects. This can be all concerning, but for the most part, they aren't dangerous. In all cases, if you're worried about your symptoms, call the Clatterbridge Cancer Centre hotline on 0800 169 5555. This is a 24-hour, 7-day-a-week service which is there to assess your symptoms and give you advice. When you contact the 24-hour Clatterbridge Cancer Centre hotline, they will provide advice and, if necessary, organise for you to have a medical review at your nearest hospital. Please bring an overnight bag and your treatment diary in case you're required to stay in. So let's take a look at some of the possible side effects of immunotherapy. Sometimes immunotherapy can cause inflammation of joints and muscles, resulting in pain and swelling. If this is mild, it can be managed with pain relief such as paracetamol. You may experience a change in your breathlessness or develop a cough. Fatigue is a common side effect of immunotherapy treatment. Eating well, resting, and gentle exercise as you are able are good techniques to manage this. You may experience diarrhea or more frequent bowel movements. Immunotherapy can affect your endocrine system, causing changes in the hormones your body produces. We will monitor this with regular blood tests. You could develop itchy skin or rashes. We can supply creams to make rashes less uncomfortable. You may also be at a higher risk of developing blood clots in your legs, known as a DVT, or lungs, known as a PE. Immunotherapy can cause an immediate reaction when it is first given. For this reason, your first immunotherapy treatment will be given more slowly. If you feel particularly unwell at any point, if there's anything out of the ordinary, or you're concerned by changes taking place to your body, please contact the 24-hour Clatterbridge Cancer Centre hotline, where you'll be assessed by an experienced nurse. Please call the Clatterbridge Cancer Centre hotline if you experience moderate to severe pain in joints and muscles, you experience a change in your breathlessness, or develop a new or worsening cough. If you're unable to complete your daily activities such as washing, dressing, and moving around your home due to fatigue. If you have frequent diarrhea, severe abdominal pain, or stools that are black or contain blood or mucus. If your skin begins to blister or peel, or if you notice any changes to the colour of your skin. You experience unintentional weight gain or loss. However, if you develop chest pain, difficulties breathing, or swelling or pain in your calves, These are emergencies and you should call 999 or attend A&E. You may find that you notice a change in your emotions too. Immunotherapy is a hard thing to go through, and many people experience heightened feelings of anxiety or worry at different points along the way. You are not alone.
Maggie's is a drop-in cancer centre that's accessible to anybody, whether it be the person with cancer or their family and friends. We're here for you at any point before, during or after treatment. Within our team, we have very skilled healthcare professionals who have all worked in cancer or psychology for many years. You can talk to one of our cancer support specialists, speak to an experienced psychologist, or find out more about the financial and practical support available to you with one of our benefits advisors. There are courses we run, like managing stress, mindfulness or relaxation, as well as weekly Pilates, yoga, exercise and Tai Chi classes. We offer workshops that provide support for those concerned about hair loss and body changes, or our Where Now course, which is also a great resource for people who've recently finished treatment and helps address some of the questions people often have about side effects and moving forward. Everything we offer at Maggie's is free, and you don't need to make an appointment to see anybody. Our building is in the grounds of the Clatterbridge Cancer Centre Wirral with free parking outside, and you can also reach us over the phone or by email.
I see firsthand the benefits visiting Maggie's has for patients in the long run. Their experience of cancer is better as a result of coming to Maggie's at any point, but especially early. I really recommend you make Maggie's part of how you live with cancer.
You get a lot of support and guidance. It lets people know that they're not on their own. You know, sometimes this journey is quite a lonesome one, but to be here and to be speaking to other people that have been in your shoes and just to have that support over a cup of tea or coffee and some cake, it's really, it's priceless.
At Maggie's, you're in a building with people who are going through something similar. No matter where you are in Merseyside or where your treatment takes place, we're here for you. You don't need to make an appointment, just come in.